One of the most valuable things I've learned through this whole experience is that I have to be open and honest with what I'm experiencing and what I'm going through. Bottling it up, trying to hide it, putting on a brave face, all of that doesn't work for me. I'm an emotional person at the best of times, but through these challenges that I've experienced, it really, really does not work to bottle it up. And people want to help. People want to know what they can do to help. And you may not know what that is, but that's okay. People, they can bring food, they can come over and hang out with you. I know when my cardiac rehab, it was friends came over to go for a walk with me because I wasn't allowed to go walking on my own because you're not allowed to do much on your own in the few weeks after cardiac surgery. But you need to go for a walk. So you need someone to go walk with. It's things like that. They're little things, but if you don't speak up, no one's going to know.
I don't know why we have bucket lists. Why do we have a bucket list? Just go and do it. Because you don't know what's going to happen to you, and you could be perfectly fine walking down the street and then your whole life is gone and you've lost that opportunity or choice to do whatever it is on your bucket list. So just get rid of your bucket list and just go and do it.
There's never a convenient time to do anything. It's easy to put stuff off and think, maybe next year will be better. I think just got to do things. Not that we're perfect at it, but it's a good mindset to have. But, I think in terms of, if I could give myself some good advice, just, I don't know, don't be too hard on yourself. It is a shocking thing to come to terms with and get used to. And, everyone's different, but I don't think it's something you can, be 6 months or a year down the track and think, I should have my head around this and everything should be back to normal. It's
don't put a time.
I think it's a life-changing event, and it takes it's not a life-ending event, or thankfully it wasn't. Life goes on, but it's really a day where our lives change course significantly, and it takes a long time to get used to that and come to terms with that.
I would say take control of the situation as much as you can. Understand what you have control of and what you don't, and submit, to the force of whatever it is you've got to go through. So lean on your support networks, make new support networks, and understand that there's physical recovery, but then there's also emotional recovery. So research into that as well, and make sure that you're prepared as prepared as you can be. That's my advice.
And the last thing, I guess, is never to make your child feel that they're sort of unable to do whatever they want to do. But in Alicia's case, there weren't limitations placed. But even if there were, to try and not give your child the impression that there's a real limit to what they do.
It is pretty remarkable what you deal with, and you do learn that you can handle a lot. But it doesn't mean that it's any less scary while it's going on. And I think that's one thing that I've struggled with, and I've had to be quite open and honest with family and friends about it when I'm feeling upset, when I've had a really challenging time, and people are like, "You're so strong, you're so brave." It's like, no, I'm not. I'm not right now. I'm not strong and brave right now. And whilst I understand why people say that, in that moment, you don't feel strong and brave, and that's okay. It's totally okay. It's hard dealing with this stuff. It's really hard. It takes a while. It's not instantaneous, and you're not going to wake up one day and go suddenly, I'm better. For me, I used to talk about getting back to normal, and in the context of my experience, was I trying to get normal before my heart diagnosis? Was it normal? But then I got married and that changed. Then we moved house and that changed. And then I had surgery and then I was pregnant and had a baby. Where's normal? There is no normal in there anymore. What point in time was normal and what was I trying to get back to? So I had to shape and be comfortable with whatever this is now.
I think it's a journey, and I think the journey shouldn't be marred by what you feel you should or shouldn't feel and where you should and shouldn't be at. And the more we use the word should, the less we actually feel good about ourselves. So I think the best thing that I've learnt along my journey is just to embrace how I actually feel and not have an expectation of where I should be. And I think once you let go of the should, it becomes a lot easier to actually recover and move through that. You have to find meaningful relationships with people who are non-judgmental. And you need to find someone who, I guess knows what they're getting, but at the same time can roll with it and can provide support even when you can't quite communicate how you feel. And I think the last bit of advice is that it will be okay. Like, it might be a new normal. It might not be what you expected your life to look like. Might not be quite where you wanted to be at this point in your life. But, you know, it's an achievement. I think anyone who's gone through a cardiac event or has grown up with a cardiac event, it's an achievement that you're still here. And I think if you take life by the reins a little bit, and you just realise that it's an achievement and it's a miracle that you've worked through it and you're still here to tell the tale, it becomes, I think, a lot easier to accept where you are and to flourish further, and to be grateful to the people and to your own mental fortitude for getting you there.